And so we start with the current slide. Well, and here are the rules and the examples of verbs which are used in both voices, the active voice and the passive voice. And these phrases are often used in explaining investigations or procedures. So active sentences say who is doing an action. So, but passive sentences don't necessarily say who is doing the action, though they can say about this. And the form of the passive voice is the following. So it consists, if we speak about the present simple passive, it consists of two parts. The first part is the verb to be in the present simple, and the second part is the verb in the form of the past participle. If, for example, it is a regular verb, we can say, let us say, play. Yes, it's regular. We can say cricket is played in this country. Yes, and if it is irregular, like write, we use the third form, write, wrote, written. So we say the letter was written yesterday, or the letter is written every day. So, and as for the forms of the verb to be, you remember them if we speak about if we say I. Yes, we use it's the form am. In singular, this is, and in plural form, this is are. So this is the form of the passive voice. And now, if we have a look at the examples here on this slide. So here is the information about positive form of the sentence, which has passive verb. And verbs here not requiring objects. It means we do not need to mention who did the action. By is not necessary here. The example of the sentence in the active voice is, the doctor attaches the needle to the syringe. So the syringe is, you remember the picture of the syringe is given here on this slide. And the doctor does it himself. Yes, that is why attaches, the verb is used in the active voice. And the passive voice sentence, the needle is attached to the syringe. We do not necessarily need to use by the doctor. We can use it, but not, it's optional. And so here the needle didn't do it itself. It was made, the action was made by somebody else, by the doctor with the needle. That is why if we place the needle at the beginning of the sentence, we need to use it. So the verb in the passive voice is attached. And the note here, we don't need to say who it is done by, because it is part of a procedure. And it's not like necessary to, it can be done by different people. I mean, by doctor or somebody else, yeah?
Ma'am, for the passive one, just in this example, the needle is attached to the syringe. If we add by the doctor, does it become active, or it still stays the passive?
No, it doesn't become active, because so you see in English the word order is fixed, and the first noun which is used at the beginning of the sentence is the subject of the sentence. In Russian, for example, it's different. We can use we can start with the syringe, yes, and I guess in your language is the word order fixed, or you can use the words or it is not fixed. I don't know.
It depends whether what we want to say in our language.
I see.
It is not fixed.
I see. So in English, it's very important. If it is used at the beginning of the sentence, it means this is the subject. And that is why the action is done with the subject, and that is why we use the passive voice. Well, and there are sentences in the negative form. So active voice, a doctor does not use a tourniquet in this procedure. So here, as far as this is the active voice, we need a negative sentence, we need to use an auxiliary verb, does here, doesn't use, does not use. And the second sentence is passive. A tourniquet is not used in this procedure. So it consists of the verb to be, is in the form of is, then particle not, and the third form of the verb use, used here. Well, and so here are the verbs requiring objects. By is necessary here. Example of the active voice sentence, sentence with the active voice, only experienced doctors perform this procedure. So doctors perform themselves. And passive voice, this procedure is performed only by experienced doctors. So if we do not use by experienced doctors, the sentence doesn't make any sense. It doesn't make any sense. So it is necessary. And negative sentences. Also the example in active voice, nurses don't perform this procedure. Do is auxiliary involved here in this form. And passive voice sentence, this procedure is not performed by nurses. We also need by nurses because this is very important. Yes. So I guess you'll have a chance to think more about this, because one of the home assignments is connected with the use of active and passive voice, and yes, you are happy about this. And yes, I see. And you'll have a chance to think more about the difference in the use of active and passive voices. Well, and here the task on this slide is to change the sentences describing procedures into the passive voice. All the sentences here are used in the active voice, and we should change them, and we should decide whether they require an agent or not. Agent is a person who does the procedure, like doctor, nurse, and so on. So do we need to use by, or it's optional here? Well, let's listen to Moht. Moht.
Yes, ma'am. Yes, ma'am.
The first sentence for you.
Ma'am, the doctor inserted the needle. So, ma'am, we can change it like the needle is inserted by doctor.
By the doctor. Do we need by the doctor, or it's optional? If it is a part
ma'am,
of
it's not optional. I think it's not optional because the ma'am needle is oftenly ma'am inserted by doctor.
Yes.
Can I ask you something?
Yeah. That's why,
yes.
ma'am, the agent is ma'am required in that particular sentence.
Yes, it's important. But here, if this is a description of one of the steps of the procedure, we just say that the needle is inserted, and that's it. We don't need by the doctor.
Yes, ma'am. Agent is not required.
Yes.
Ma'am, can I ask something?
Yes, Priyesh.
I mean, I couldn't. I mean, I was not able to join, ma'am. I joined right now.
I see. Okay. I see. Okay.
Ma'am, can I ask you something?
Welcome back. Yes, Aman.
Ma'am, in the first one, the doctor inserts the needle. So it is happening in the present, and it is happening. So isn't it like if it convert that in the passive, then the needle is being inserted by the doctor?
You offered to use present continuous passive, right?
Yeah.
Is being inserted. Yes, it's possible if we describe the process that we see, and you are just describing what can you see there, for example, on the phone, and you say the needle is being inserted. Yes, But if it is a part of a procedure, like if it is one step of the instructions, we can say it's done. It should be done like normally done, commonly done. That is why we can say we can use the present simple. So the needle is inserted. Okay. As for the next sentence, let's listen to. Yes, Aman. It's for you.
Nurses often perform this procedure. This procedure is being performed by nurses. Is been B-E-E-N.
Look, we are speaking about like here. We are speaking about where is it? Yes, the present passive. Yes, the present passive. The present simple passive. Okay. Let's just focus on the present simple passive, not present continuous. Sorry.
Okay.
So it is
this procedure is often performed by the nurses, by nurses.
By nurses. Okay. So here it's very by nurses is very important to use because this is what the sentence is about. Yes. And the next is for Apeksha, please. Number 3.
Yes, ma'am. The doctor then applies gentle pressure to the puncture site. The answer for this is gentle pressure is applied at the puncture site by the doctor.
And here by the doctor is also optional because the main thing is that we focus on the gentle pressure which is applied. We can omit the doctor. The next is for Misha. Number 4, please.
Yes, ma'am. The sister explains the procedure to the patient. The answer for this question is the procedure is explained to the patient by the sister. By the sister is optional.
Optional here. Yes, you're right.
Yeah.
The next is for Nivas.
Yes, ma'am. Fifth question is the nurse cleans the skin. Here answer is the skin is cleaned by the nurse.
By the nurse. Do we necessarily need to use by the nurse or is it optional?
I think it is optional.
Optional, you're right. Okay. So the next sentence is for Vandana.
Yes, ma'am.
Number 6.
Doctors without training don't perform this emergency procedure. Ma'am, I think the agent is required here.
Okay. So and what is the passive voice sentence? Will you repeat it?
Doctors without training don't perform this emergency procedure. The emergency procedure is not performed by doctors without training.
Yes, you're right. This is required.
Ma'am, can we use untrained in this sentence? I mean, is this allowed in this question, ma'am?
Sorry, what?
Ma'am, can we use untrained on the place of without training in this question? I mean, is it allowed to change the word?
If we say
because if we say without training, it will be wrong on the grammatical part. This isn't wrong by the doctors.
Both will be right. It won't be wrong.
Who aren't trained, then we have to change the sentence.
Who are not trained.
Yeah, ma'am. We have to change the sentence if we use this, or it will be trained doctors.
Just let me give me a sec. This emergency procedure is not performed by doctors without training is okay. What's wrong grammatically? Without doctors, by doctors who were not trained is also possible. Yes, we can change the last part.
Both are right.
Yeah.
That's what I was asking, ma'am. Can we change it?
Yes, we can change, of course. Yeah. Well, and the next we will listen to. Yes, Priyesh, are you here?
Oh, yes, ma'am, I'm here.
Yes, I see you.
Taps the vein. So it will be the vein is tapped by the doctor.
Yes, you're right. And is it required or is it optional? By the doctor.
What, ma'am? By the doctor, ma'am, is optional, ma'am.
is optional. Okay, and then is Rakhav, please.
Yes, ma'am.
Okay. Mhm.
Ma'am, generally nurse don't perform this producer. Ma'am, this is a passive base. Ma'am, nurse is not performing a procedure.
If we place this procedure on the first at the beginning of the sentence, so we start. Generally, this procedure.
Yes.
Then we need to use perform in the passive voice.
Passive voice.
So who can help us?
Generally,
Generally, this process is not performed by
Not
nurse.
performed by the nurse.
Ma'am, don't will be transformed to
Yes,
isn't.
is not performed by nurses. Yes,
By nurse.
and it's necessary. Yes, because we focus on the nurses here. Yeah. Mhm.
Yes.
Okay. Well, let's go to the next slide. Here we have the information about the picture, the illustration, the diagram of gastroscopy, medical device, which is shown on the diagram. And so you see there are some gaps there, and we should understand what are the parts of this device, and the parts of the device are given here to the right. So they are flexible tube side channels for introducing other instruments, a grabbing instrument, a light and camera, and endoscope itself. So what is the first picture? What is it?
Endoscope.
It is camera.
Yes,
Ma'am,
the device
endoscope.
itself.
Endoscope.
Picture number 2.
Endoscope.
Ma'am,
it is
side
grabbing
channel for
instrument.
introducing the other
Ma'am, it is a grabbing instrument.
Side channel.
Grabbing instrument.
Number
Side
2.
channel.
Ma'am, it's a side channel.
Yes,
Side channel for
For
introducing
yeah,
other
I
introducing
see,
other
you know,
instrument.
side channels. Number 3.
Ma'am, the flexible tube.
Flexible tube.
Okay.
Then number 4
Ma'am,
is
this one is
Grabbing
grabbing
instrument.
Ma'am, this is a
yes,
grabbing
this
grabbing
is
instrument.
instrument.
for biopsy. And
Yes.
number 5 is
A light
A light and
and
camera.
Light and camera.
exactly. So we just now understand what this medical device consists of, and we need this just because here they work with just the process of gastroscopy is described here on this slide. There are some sentences. You can see that there are gaps or 2 gaps in each sentence. And we need to complete the gaps, the sentences, by choosing a word from either the noun or verb list. If you have a look at the sentences, you can see that all of them have verbs in the passive voice, because the first part of the passive voice form is given is, yes? And it means that the verbs should be used before, no, after is. And if we have a gap before is, we should use a noun here, before is. So the nouns are section, consent, patient, air, endoscope, mucosa. What does it mean, mucosa?
Ma'am,
It's
it is
the
the
layer.
internal layer of
Lining of
the
Yes.
Lining of
back
the
the
gut.
structure.
I see,
Yeah,
okay.
Lining in the
gut and
innermost
our
lining.
stomach.
Innermost
see.
lining.
Okay. And the
It
verbs
is
are,
the innermost layer of our alimentary canal.
I see, okay. And blow, advance, swallow, give, obtain, sedate, anesthetize, and biopsy. Biopsy is the verb here, to biopsy, okay? Now I want you to, everyone to think individually about the missing words here. I'll give you 5 minutes to complete the sentences. So you may write the sentences or just yes, and complete them with the words which are missing. You see? So 5 minutes to you.
Yes.
Mhm.
Ma'am, we need to write the full sentences.
It's for you. Just you decide yourself.
And these words aren't in the past. I mean, aren't in the third form. So we need to convert them to third form, ma'am, I think.
Exactly, yes, because we were speaking about this. The form of the passive voice is made of to be plus past participle of
Yes,
the
ma'am,
main
participles and past
verb.
participles.
It should be in the past is regular, for example. It's danced. If it is irregular, blow, blew, blown. Yes.
Yes,
It means
ma'am.
blown.
If we have done, then we have to submit this to somewhere.
No, we're going to check it
The
now.
last.
Well, so who did we stop with? It was Rakhav, yes? Let's listen to Sayunika, the first sentence.
Inform the patient that he is Anesthetized.
Mhm. Yes, it's possible. Mm, mm. Well, any other ideas?
Ma'am, the patient consent is being informed. Informed means
Informed patient is
Consent.
consented.
Consented.
Informed patient is consented.
yes, ma'am.
Consent is a noun here. We need to use the verb after is.
Verb after them.
There is no consent here.
The patient is anesthetized. I think this one is
Yes,
correct.
that is the right one.
Informed.
Okay, if we speak about the first stage, the first step in the gastroscopy procedure, yes? So
Ma'am, informed patient is anesthetized, informed patient is sedated. Yes, ma'am.
Yeah.
if we speak about consent,
Sedated.
if we say informed consent, which verb should we use here?
Informed consent is obtained.
Obtained. Yes,
Obtained.
informed consent is obtained. Let us just take this one because this is the first step. Okay. Now let us listen to Rohit. Are you here, Rohit? No. Ritik, please.
Yes, ma'am. The pharynx is anesthetized using a spray. Ma'am, because a spray is used for anesthesia, giving anesthesia to a person.
Exactly. The pharynx is anesthetized. And pharynx, do we know another word for pharynx?
Yes, ma'am. Glottis.
Throat.
Voice box.
Voice box, ma'am.
I see. Okay. So the next is for Moht.
That's larynx, not pharynx.
Yes, ma'am.
Moht, please.
Ma'am, the fourth one.
Number three.
Okay, ma'am. Ma'am, the patient is anesthetized to induce the drowsiness.
Or we have already used
Sedated, ma'am.
Or ma'am, we can use sedated also.
Yes.
Sedated to induce
Okay, thank you.
drowsiness.
The next is for Aman.
Yes, ma'am.
Number 4.
The endoscopy is introduced and is swallowed further down the esophagus and into the stomach and duodenum. So the main point is endoscope and swallowed.
I see. And swallowed should be used in another sentence.
Yes,
And
okay. So
apart
it's
from
advanced.
Advanced is also used.
because
like
it's
Because it is in third
further
form, so we can't
down.
use swallowed
Yes.
here.
Okay. So the next is for Apeksha. Apeksha. Number 5. Apeksha, are you here?
Yes, ma'am. For the fifth one, yes, ma'am. I'm facing some network issues, so I'm sorry for that. For the fifth one, the biopsy is advanced into the stomach via a side channel in the endoscope to allow the visualizations of the stomach mucosa.
Well,
Ma'am, air is blown.
Ma'am, the air is blown.
Yes, air should be used here. Air is blown into the stomach.
Air is
to the
blown.
stomach.
Okay.
Yes, ma'am.
The next one is for Misha, please.
Yes, ma'am. The patient is given a plastic mouth guard to bite on.
Yes, right. Okay, the next one is for Nivas.
Yes, ma'am. The patient is asked to consent the first and
So who can help us?
Yeah.
Swallow.
To swallow the first section of the endoscope. Okay, and the last one is for Vandana.
The stomach dash is dash using the thin grabbing. The stomach is just 1 minute. Stomach section is
Obtained.
Obtained is done already. We did
Biopsy.
The stomach.
The
The stomach mucosa is is obtained using a thin grabbing
Yes,
instrument which
the
is passed
stomach.
down the
Yes. The stomach
Yeah.
mucosa is
glucose.
Yes, okay. Well, these sentences are given on this slide, and there is the illustration of drowsiness, as you see. And so if we just agree with these options here, the task is
When we did wrong, ma'am, the
Ma'am, in
endoscope
the
is
last
advanced,
one-
it will be endoscope is introduced. Here,
And ma'am, in the last one, the
In the fourth
the
and the last
mucosa is
one, it was
biopsed.
Biopsy, we use obtained.
advanced. Yes, you're right. It's a mistake here. It should be the endoscope is advanced.
And ma'am, in the last one,
It's
ma'am,
advanced.
it's not
given
obtained.
here. I mean, it's not marked like introduced is highlighted here, but is advanced.
ma'am,
is
that's
given here.
right.
Yes. So, well, the task is to think of the correct succession of the steps here. We should put the statements in the correct order. So I think the phrase which is given first, it should be number one, step number one, because we know that informed consent should be obtained from the patient. Informed consent is the agreement so for invasion procedure, which is given by patient after procedure has been explained to him. Yes, informed consent. So what is step number 2?
3, ma'am. 3. The patient is sedated.
Sedated to induce drowsiness. Number 3. Step number 3.
The pharynx is
anesthetized.
Anesthetized using a spray. Step
Yes,
number 4.
6. The patient
Ma'am,
is
is
given
sedated.
mouth guard to bite on.
Yes, to bite on. This is number 4. Step number 5. Yes. What is it?
Endoscope is introduced. Fourth, ma'am.
Endoscopy is the patient
Air
is
is
asked to
blown.
swallow the first section of the
The
endoscope.
first section of the endoscope. This is number
Patient is
5.
asked to swallow the first section.
Yes. Number 6. What is?
4, ma'am. It will
Fourth
be 4.
one, endoscope is
four.
introduced.
The endoscope
Yes.
is
Introduced and is advanced further down.
You're right. And that was number 6. Number 7.
Ma'am, it will be
Fifth
number
one, air is
7.
blown.
The patient
Air
is
is
severed.
blown from the stomach.
The air is
About the
blown
air.
by stomach.
Yes,
Air
ma'am,
is
by
blown.
yes, that's fine.
And number 8.
By the side channel.
The stomach
Ma'am, the stomach mucosa is biopsed.
Biopsized using thin
Biopsized.
grabbing instrument, which is passed down the side channel.
Exactly. So it's on its place. Well, good. And now we are going to listen to Dr. Dr. who?
Queen.
Dr. Quinn. Yes.
Queen.
He's planning explaining the endoscopy to patient Mr. Beacon. And we should understand which steps the doctor mentions. Does he mention all 8 steps or only part of them? Let's get started.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
So, does he mention all 8 steps?
Yes,
ma'am, we did wrong in the last.
No, ma'am. Can you please once again play the audio?
Unfortunately, we are short of time. So who can answer this question?
I can.
Ma'am, I can.
Yes, please, Priyesh.
Ma'am, first of all, we'll ask for the consent from the patient, and then we'll do you know what this gastroscopy is? Then I'll explain him what gastroscopy is, and I'll tell that it is used for, the doctor will tell that it is used to look at the gullet and the stomach. Then we'll actually give you something to bite. I will give the patient something to bite on, and then we'll numb the throat, and we'll put the tube down through the throat to until stomach, which is no longer which is no more thicker than our finger, and we'll have a camera. And if we find anything which is not actually significant, then we'll actually take a tissue sample from there, and we can blow air in the stomach and see what exactly whether we can blow air and see clearly. And
yes, so he just mentions almost all the steps here, and what we need to focus now is on the use of the words the doctors used instead of these medical terms. Now we'll listen for the second time, and you should write the words next to them. So the words that were used by the doctor.
Listening to.
Ma'am, wait, ma'am, don't wait.
I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be. Listening to.
Well, the answers are given here. These are gullet, numb, throat, bendy tube, take a tiny tissue sample, something to help to relax, look at, then belch, and see. We need to just focus on the home assignment. So there'll be two of them. The first is you'll start after the class, you'll deal with the exercise with the verbs in the passive and active voice. So the document, the file is attached on the Moodle site. You'll start doing this. And the home assignment number 2, this is like write an essay. It's also given on the Moodle site, and it should be typed so in Word format, so that the file should be clickable and accessible for editing. It's very important for me just to know, to get some feedback from you. So that is why I'm asking to write this essay.
Ma'am, but there's an issue with Moodle, ma'am. We can't upload Word file. We can only upload
You
PDF.
can, because I just adjusted the system so that you can upload the Word format, Word file.
Okay, ma'am, we'll submit. Okay, ma'am, we'll upload it.
Okay.
Okay, see you next week.
Okay,
Thank you, ma'am.
Bye-bye.
Have a good day. Bye-bye.
Have a good day, ma'am.
Have a nice day.
Goodbye.
Bye-bye.